Well, I'm lucky to be here in Lumberton to join the hospital staff. I'm an orthopedic surgeon with an emphasis on the upper extremity, so I operate on shoulder, elbow, wrist, and hand problems. Well, born and raised outside of Philadelphia in the area known as Bryn Mawr, which some people know as the main line, but haven't been back up north for a long time. So I've spent my training initially in Pennsylvania at Bucknell University, went to Philadelphia College of Medicine, and then spent 5 years in Oklahoma City, where I was in my residency. After completing my orthopedic residency, I went to Louisville, Kentucky, where I completed an upper extremity fellowship in microvascular surgery. Well, I'm a very strong advocate for rheumatoid patients because of a family member that suffered from rheumatoid disease. So in my previous practice, I ran a rheumatoid support group. I also founded an organization called AMPS R Us, which was an organization for people who had suffered amputations of upper or lower extremities. We helped them in getting their prosthesis and modifications for their lifestyle, whether it's wheelchairs, walkers, or crutches. Orthopedics always intrigued me. It's a field, obviously, where there's tons of technology that's changing at all times and very challenging, and so I find that fascinating. In addition to that, I played a lot of sports, had a lot of injuries, so I spent my fair share of time in an orthopedic office, whether it was for a broken ankle or a broken wrist or an ACL injury. I've had, unfortunately, some surgeries that have had to be done, but it's made me a better doctor because I've been in the position as the patient. So I do a lot of complex shoulder, elbow, wrist, and hand work. Specifically, microvascular surgery is the art of reattaching something and reconstructing it to get it to work, whether it's of the upper or lower extremity. So when I traveled to Louisville, Kentucky, where they are world experts in this field, you have lots of experience in this type of reconstructive surgery. So it's a combination of plastic surgery and orthopedic surgery in order to get these patients up and running and back to what they like to do. My interest, because I've done this for 16 years, has allowed me now to do many, many cases for either athletes or workers or just your average individual with arthritis or tendinitis, nerve, artery, vessel, tendon problems. So I've been very fortunate. I've had a chance to work with some professional athletes and semi-professional athletes that's allowed me to do some more of the complex work and complicated work. But it's really a fun experience to get people back working again or playing again. There are some procedures such as artificial joint replacement that I do, tendon procedures that I do, revascularizations and reconstructive procedures that have not been available. They've been sent to either tertiary centers or university centers. But because of my affiliations in my societies and organizations and my interest in keeping up to date, we're constantly going to push the envelope and bring new procedures here to Lumberton. We're not trained as engineers, but during orthopedic training, you do study the body as if it was a set of levers and mechanical joints, if you will. So some of our training does help us in that field, but I went back and actually did some work with ergonomics. And so I've spent a lot of time now going from businesses to businesses and helping them look at where the problems are, correcting those problems, and actually preventing injury. So with that experience, I've now done some consultation, if you will, where I've gone into companies and we've talked about these things. You know, the hot topics today in the work field is you want to avoid the OSHA reportable days lost. You want to prevent injury. Obviously, there's ramifications for that economically, but also on the government side. So we want to have people working in safe environments and returning them to safe environments. So that's really where I've spent a lot of my time. But I've had an extreme amount of, or I should say a large experience with work industry, whether it's with hog farms, beef plants, or if it's postage cards or ice cream companies, manufacturing companies, really of all sorts. So it's really been an interesting experience where I've gotten to know the industrial side of things. So recently I've worked with some tire producing plants. I've worked with some drug companies and their productions, and also some furniture companies and textiles. You know, it's wonderful to be here in Lumberton. It's an honor to join such a wonderful hospital and the hospital staff. I look forward, and my family look forward to becoming active members of the community, both in the church and the civic groups, raising our kids here, getting them involved in the various school sports and activities. So I'm glad to be here, look forward to meeting people and becoming a neighbor.